Well, now, public health actors are worried about the lack of funds to fight and promote issues of environmental health in the country. According to them, the absence of a centralized ministry responsible for public health makes it difficult to access funds, a situation they say is suffocating the aim to make Accra clean. They are calling for the passage of the National Health Sanitation Bill, which, among other things, is expected to harmonize activities of public health actors in the country. Michael Ashali has more in this report.
World Environmental Day is celebrated on 26th of September every year to put the spotlight on the crucial work done by environmental health workers. This year, the day was celebrated under the theme Strengthening Environmental Health Systems for the Implementation of Sustainable Development Goals. Public health activities in Ghana are split among 3 ministries and largely uncoordinated. According to Environmental Health Metro Director for the Accra Metropolitan Assembly, Florence Kuchi, the situation is making it difficult to properly deal with the worsening sanitation problem in Accra.
We are supposed to be under local government ministry. That is our mother ministry. But as it stands now, we do not even have a desk there to say that this desk is for environmental health workers, that there will be a supervisory head there who will champion environmental health issues at the departmental, ministerial or interagency collaboration aspect. So this has been a very big issue. This gap is really having a big pinch on the environmental health officer when it comes to how we implement our duties in the country. So Ministry of Local Government doesn't do any budgeting for us, nor does Ministry of Sanitation does any budgeting for us. When you go to Ministry of Sanitation, the head is there without a body. Then you come to local government, the body is there without a head. How can only body work without a head, nor a head work without the body? So as time is going on, if care is not taken, the name environmental health is going to phase out. And if it is phased out, it's going to have a very big havoc to the country and the people as a whole.
Without a supervisory agency, the aim to make Accra the cleanest city in the sub-region will remain on paper. Director of Waste Management at the AMA, Ninoy Norte, explains why.
On this day, we are re-emphasizing. Now we are torn between 3 ministries and we become orphans. They are supposed to carry our budgets along and then budget for our logistical needs and retooling to be able to perform efficiently. Then comes the sanitation ministry also. Yes, they are in charge of sanitation. The MEST will also come and say, yes, we are also in charge of electronic waste management and then plastic waste management. So now you see the 3 mothers, so to speak. When we need logistics, like vehicles, as it is raining and you need to go undercover and grab those who are dumping the waste in the drains. You can't walk in the rain.
Lecturer at the Accra School of Hygiene, Michael Afodope, is asking Parliament to pass the National Health Sanitation Bill. According to him, the bill, if passed, will resolve issues of supervision and greatly sharpen the focus to deal with sanitation.
I was calling for us to all join our voice together on the advocacy for us to create the National Sanitation Authority as a matter of urgency, because when that authority is actually created, or that bill is passed into an act, it will help to centralize the National Sanitation Authority bill. When it is passed into an act, it will help to centralize all environmental health activities under one umbrella, so that staff at the lower government service, those at the Ministry of Sanitation and Water Resources, anyone performing an environmental health sanitation activity will be responsible to this particular authority, and I'm sure that will address all these structural gaps.
Public health agents are also calling on government to retool environmental health officers to effectively discharge their duties. For JoyNews, Michael Ashale.